The strange reason your eyes feel dry all day. Most people think dry eyes mean one simple thing. You are not drinking enough water. So they drink more water. They splash their face. They buy random eye drops. They blame the weather. They blame age. And when the dryness keeps coming back, they get frustrated and think, why do my eyes still feel dry all day? But here is where people get fooled. Your eyes may not be dry because your whole body is dehydrated. Your eyes may feel dry because the tear layer on the surface of your eye is breaking down too quickly. That is the strange reason many people miss. You can have tears in your eyes and still feel dry. You can drink enough water and still feel burning, grittiness, redness, blurry vision, or that annoying feeling like sand is trapped under your eyelid. Dry eye happens when the eyes do not make enough tears, or when the tears are not stable enough to keep the eye surface wet. The National Eye Institute explains that dry eye occurs when tears do not properly keep the eyes moist, and it can cause stinging, burning, scratchiness, redness, blurry vision, and sensitivity to light. And after 50 or 60, this becomes much more common. Not because your eyes suddenly become weak, but because the entire tear system becomes more fragile. Your eyelids, oil glands, blinking pattern, hormones, medications, screen habits, sleep, air quality, blood sugar, thyroid health, and immune system can all affect how comfortable your eyes feel. Most people think tears are just watery drops. But your tear film is more complex than that. It has layers. One layer helps the tears spread, one layer provides water, and one oily layer helps stop the tears from evaporating too fast. That oily layer is extremely important. Along the edges of your eyelids, there are tiny glands called meibomian glands. These glands release oil into your tears. That oil helps seal the tear film, so the watery part does not disappear too quickly. But if those glands become clogged, inflamed, or less active, your tears can evaporate faster. Your eyes may feel dry all day even if you are producing tears. This is where it gets interesting. The problem may not be that your eyes have no moisture. The problem may be that the moisture cannot stay. That is why some people say, my eyes water all the time, but they still feel dry. It sounds impossible, but it makes sense. When the surface of the eye becomes irritated, the eyes may reflexively produce watery tears. But those emergency tears may not have the right balance of oil and moisture. So the eyes water, yet still burn, sting, and feel dry. This is where people get fooled. They think watery eyes mean dry eye cannot be the problem. But watery eyes can actually happen when the eye surface is irritated by dryness. One major trigger is staring without blinking enough. When you read, use your phone, watch TV, drive, or work on a computer, your blink rate often drops. And even when you do blink, the blink may be incomplete. That means the eyelid does not fully spread the tear film across the eye surface. Every blink is like a windshield wiper. It refreshes the tear layer, it spreads oil. It keeps the surface smooth, but if you blink less often for hours, the tear film can break apart. Then the eyes start burning, stinging, or feeling gritty. The NHS notes that dry eyes are more likely if you are over 50. Look at screens for a long time without a break. Spend time in air-conditioned or heated environments, or take certain medicines. That sounds small, but it matters, because many people do not connect dry eyes to a daily pattern. They wake up, check the phone, watch the news, drive, read messages, use a computer, sit under a fan or air conditioner, then watch TV at night. The eyes spend the whole day exposed, focused, and under blinking. And after 60, the tear film may already be less stable. So screen habits that were harmless at 35 can become irritating at 65. The second hidden trigger is dry indoor air. Air conditioning, heating, fans, car vents, ceiling fans, and low humidity can all make tears evaporate faster. You may notice your eyes feel worse in the car, in a heated room, in front of a fan, on airplanes, or during winter. Most people blame the eye itself, but sometimes the eye is reacting normally to an environment that keeps stealing moisture from the surface. A strange clue is this: if your eyes feel better outside in mild weather but worse indoors, the air around you may be part of the problem. If they feel worse when the fan blows toward your face, or when the car vent hits your eyes, that is not random. That is evaporation. The third trigger is eyelid inflammation. This is one of the most overlooked causes of dry feeling eyes. The eyelids are not just skin covers. They are part of the tear system. If the eyelid margins become inflamed, crusty, irritated, or oily, the tear film can become unstable. This can happen with blepharitis, meibomian gland dysfunction, rosacea, allergies, or chronic irritation. You may notice crust on the lashes in the morning, red eyelid edges, burning that is worse later in the day, eyes that feel sticky, or blurred vision that improves after blinking. This is where people get fooled. They keep putting drops into the eye, but they never address the eyelid. It is like adding water to a leaking bucket without fixing the leak. Warm compresses and gentle eyelid hygiene may help some people, but if symptoms are persistent, an eye doctor should check whether the oil glands are blocked or inflamed. The right treatment depends on the cause. The fourth trigger is medication. This is a big one after 50. Many common medications can worsen dryness in the eyes or mouth. Allergy medicines, some antidepressants, blood pressure medicines, bladder medicines, sleep aids, decongestants, pain medicines, and some acne or hormone-related treatments can contribute in certain people. Mayo Clinic lists aging, certain medications, medical conditions, eyelid problems, and environmental factors among causes and risk factors for dry eyes. This does not mean you should stop your medication. Never stop a prescribed medicine on your own. But if dry eyes began after a new medicine, a dose change, or adding an over-the-counter allergy or sleep product, that timeline matters. Most people never mention dry eyes to their clinician because they think it sounds too small. But dry eyes can affect reading, driving, sleeping, mood, and quality of life. It is not a small problem if it follows you all day. The fifth trigger is blood sugar, thyroid, autoimmune disease, and inflammation. This is where dry eyes can become a deeper health clue. Some people develop dry eyes because the tear glands or oil glands are affected by medical conditions. Diabetes, thyroid disease, rheumatoid arthritis, lupus, rosacea, and Sjogren's disease can all be linked with dry eye symptoms. Mayo Clinic Health System notes that people with rosacea, diabetes, thyroid disease, autoimmune diseases, and inflammatory diseases such as rheumatoid arthritis, lupus, and Sjogren's syndrome are more likely to develop dry eyes. Sjogren's disease is especially important because it often affects moisture-producing glands. Mayo Clinic describes Sjogren's as a chronic immune condition whose two most common symptoms are dry eyes and dry mouth. Now, this does not mean every dry eye is autoimmune disease. Most cases are not that dramatic. But if your eyes are dry all day and your mouth is also dry, if you need water to swallow food, if you have joint pain, unusual fatigue, swollen glands, burning mouth, dental problems, or dryness in other areas, do not ignore the pattern. Most people separate symptoms into different boxes. Dry eyes go in the eye box. Dry mouth goes in the dental box. Joint aches go in the age box. Fatigue goes in the stress box. But the body does not work in separate boxes. Sometimes dryness is local, sometimes it is systemic. The sixth trigger is sleeping with the eyes slightly open or waking with exposed eyes. This sounds strange, but it happens. Some people do not fully close their eyelids during sleep. Others have eyelid changes, facial nerve issues, thyroid eye disease, or sleep habits that leave the eye surface exposed. Some people using sleep apnea machines may also get air leakage toward the eyes, which can dry them overnight. The clue is waking up with dry, burning, scratchy eyes that improve a bit after blinking or using drops. If mornings are the worst time, the nighttime environment matters. A fan blowing across the face, sleeping under dry heated air, or air leaking from a CPAP mask can all leave the eyes irritated by morning. If this is happening, do not just keep adding drops without asking why the eyes are drying while you sleep. Now, what should you actually do? First, stop assuming water alone will fix it. Hydration is important, but dry eye is often about tear quality, evaporation, blinking eyelids, medications, and inflammation. Second, protect your blinking. When using screens, take regular breaks, blink fully and intentionally. Look away often. Keep the screen slightly below eye level so your eyes are not open too wide. If you read or watch TV for long periods, remind yourself that your eyes need movement and blinking, not just focus. Third, protect your environment. Do not aim fans or vents at your face. Use a humidifier if indoor air is dry. Wear sunglasses outdoors, especially in wind. Be careful with smoke, dust, and strong fragrances. Fourth, consider preservative-free artificial tears. If you use drops often, some drops are designed mainly to reduce redness, and frequent use of redness relief drops can sometimes worsen irritation. Lubricating drops are different. If you need drops many times a day, ask an eye professional what type is best. Fifth, take eyelids seriously. If your eyelids are crusty, red, oily, or irritated, the problem may be at the lid margin. Gentle lid cleaning and warm compresses may help, but persistent symptoms should be evaluated. Sixth, review medications. Ask your clinician or pharmacist whether any of your medicines could be contributing. Do not stop them yourself. Just get the connection checked. Seventh, look for deeper clues. Dry mouth, joint pain, fatigue, thyroid symptoms, diabetes, rosacea, numbness, or repeated inflammation may mean the dry eyes are part of a bigger pattern. And finally, know when to get help. If your eyes are painful, very red, sensitive to light, producing discharge, suddenly blurry, injured, or if vision changes do not clear with blinking, get medical care. If dry eyes persist despite home care, see an eye doctor. The American Academy of Ophthalmology explains that dry eye can have multiple causes and treatments, including artificial tears, lifestyle changes, prescription medicine, and procedures in some cases. The main message is simple. Your eyes may feel dry all day not because you forgot to drink enough water, but because your tears are evaporating too fast. Your eyelids are inflamed, your blink rate is too low, your indoor air is too dry, your medications are affecting moisture, or a deeper health issue is changing the tear system. Dry eye is not just an eye comfort problem. It can affect reading, driving, sleep, concentration, and daily life. So do not just tolerate it. Do not just keep buying random drops. And do not dismiss it as normal aging. Look for the pattern. When is it worse? Morning or evening? Screens or outdoors? Fans or air conditioning? After medication changes? With dry mouth? With allergies? With blurry vision? With burning eyelids? That pattern can reveal the real reason. Because sometimes your eyes are not asking for more water. Sometimes they are asking for better blinking, healthier eyelids, calmer inflammation, cleaner air, smarter medication review, and the right eye care before irritation becomes your new normal. Your eyes are not just dry. They may be telling you that the tear system protecting them all day is breaking down faster than you realize.